Welcome to my room, excuse the mess. Today I'm just going to talk about a few tips for getting in and out of bed, managing pubic symphysis pain, which aka lightning crotch. This is something I'm dealing with this pregnancy that I did not deal with or have during my pregnancy with Benji. You know. So just kind of going with the flow. One of the biggest tips I'm going to give you, I actually learned from Ashley at Get Mom Strong, is to move like a mermaid. So tend to have more pain through the front side when you're taking your legs out pretty far. So going into like a lateral lunge, maybe some walking, getting out of the car, thinking about swinging your legs open. So literally thinking about moving like a mermaid. So for a couple tips for getting in and out of bed and then also sleeping, this is what I got for my pelvic floor PT, which has been super helpful. So the one thing you're gonna want is just a pillow. You don't even necessarily need a full body pillow. It's not totally necessary, so I just have this one pillow. The biggest thing, getting in and out of bed, I kind of try to sit down, and instead of like with my legs, I try and kind of bring my legs in, rolling from my side, and kind of bring everything into my bed. I know you have a nice view of me. So the other thing is I want you to think about pillow placement. So it's more important to have the pillow placement from the knee down. So I'm gonna have that knee down because this is gonna kind of help keep my pelvis in check up above. Then, so we have the pillow placement. Sometimes you'll find the recommendation with the full body pillow to go from basically pubic bone all the way down, but not everyone has one of these, so my PT recommended just having from the knee down as a big thing to consider. The next thing is you want to find a wedge for the belly. So I'm going to take this cute little pillow that I have behind me, and I'm just, as I lie on my side, I'm just going to kind of form a wedge. And basically this is gonna prevent my tummy from rolling back and forth. This pillow is gonna keep my legs and my pelvis nice and secured, and I have my wedge. Now the wedge for the belly can also be a rolled up blanket, towel, anything along those lines. My biggest pain or problem is I experience pain when I roll over. So when we're in our third trimester, we tend to be lying on our side. I tend to get on my left side. I'm just gonna move my wedge. And so the biggest thing when you rotate in is you wanna have that hug of the belly, that core engagement and support before you roll over. I know this is tough at 2 a.m. when you're not really thinking about it, but I have my pillow behind me and right here. And as I get ready to roll, I have my wedge, remember my wedge. I think about that inhale, belly expands, exhale, and I rotate to the center. Then from there, inhale, exhale, and I rotate to the other side. And I keep my pillow with me, supporting me as best as I can. When I come out of bed, remember I move like a mermaid, and then I press up to stand. So we don't want to ever jerk ourselves out of bed. We want to roll to our side, kind of use our palms to kind of press us up. So in summary, when we want to move in bed, we're going to find that pillow wedge. We're going to have a pillow from knee down to ankle. And before you move and rotate from one side to the other, I want that inhale, exhale. So you have that core support before you move your body. Doesn't need to be a full rotation. You can just rotate to the middle and then rotate to the side. So those are a few tips for kind of maneuvering in bed. And remember, move like a mermaid. So you just want to be gentle with your movements and avoid any quick jerking, because not only is that going to cause discomfort through your front side, but you're also putting a lot of additional pressure on the abdominal wall out. So, and also think about breathing. I know that at 2 a.m. you're like, oh, whatever, but just think about it, because it's gonna, that lightning at 2 a.m. is not gonna feel good. So take that time to really think about what it is you're doing before you add the movement side to side. If you wake up and you're on your back, it's cool. Just move to one side or the other. Your body will know if you've been on your back too long and you need to maneuver. Usually dizziness, maybe you feel nauseous. There's other different signs that your body will tell you that you need to get off your back. Please message me with any questions, and I hope you feel good, Mama.